It's the Slam Dunk.
Okay, it's Men's Health Week, and we need to speak about the truth. It may be uncomfortable to people about this. It may be confronting, and sometimes it's even not seen as acceptable to say this, but New Zealand men get a raw deal when it comes to health. Here's the truth in New Zealand. Research shows that for every dollar spent on women's health, only 6 cents is spent on men's health. For every dollar on a woman, a man gets 6 cents. For every $1, 6 cents goes to men. It's incredible, isn't it? We are shortchanged, and it's not often acceptable to say so. And it's not acceptable to campaign sometimes for a better deal, but this week we can. This means that a significant disparity exists in the allocation of things like resources towards different health issues between men and women. And men are on the back foot from the start. Here's some facts. A boy born today will live nearly 4 years less than a girl born in the room next door in that hospital. He'll be over 20% more likely to die of a heart attack than a girl, and almost 30% more likely to get diabetes. Worse, he's 3 times more likely to die by suicide or in a motor car crash. 8 New Zealand families every day lose a loved partner, a father or relative to a preventable illness, one they didn't need to die from. That's the truth. Māori and Pacifica men live significantly shorter lives on average than other races in New Zealand. So we know all this stuff. And it's wrong. Almost 1 New Zealand man in 4 will die before they reach the retirement age. 1 in 4 of us won't retire. That's my dad. At 62, cancer took him when he had been seen earlier. He might have lived much longer. Successive New Zealand governments have failed to develop a policy or strategy focused on men's health, falling behind countries like this. How's this? New Zealand's behind these countries. Mongolia, Ireland, Australia, Iran, Malaysia, South Africa, Brazil, and the state of Quebec. Women outlive men by 4 years, and for men aged between the ages of, say, 50 and 75, the death rate is 30% higher than for women. It's incredible, isn't it? And we bounce along and sort of accept this all year. Every year, until this week when we talk about it. The life expectancy for Māori and Pacific men is between 7 and 5 years less than other men. So people in those families lose their dad, lose their uncles much, much earlier. Additionally, men are more likely to live with an illness or injury, and as a result, they will die prematurely. These health inequalities were highlighted during the COVID-19 pandemic as well, with men contracting COVID at higher rates, experiencing more severe symptoms and being more likely to die in New Zealand. There's also a stark disparity between male and female deaths by suicide, and this is pretty confronting too. In 2018, 446 men died by suicide, compared to 177 women. It's a pretty incredible number. What stops men going to the doctor? I'm one of those, and I'm bad at it. Many men are reluctant to seek care and support from the health system, arguably because, well, we say it's not structured around our needs. Primary care services are generally only open at times when we're at work. Generally, men only think about their health if an issue prevents them from undertaking something important and practical aspect in their lives, like sport, or playing with their children, or doing their job. So if it affects that, then we might go to the doctor. Consequently, we're unlikely to seek help unless our functional ability is affected. Ultimately, this means that men are seeking help for health problems much later. We all know this, and it results in higher levels of potentially preventable health issues, reduced treatment options and greater use of more expensive hospital services. Sadly, men are also at higher risk of being fatally injured through our jobs, not this one, but many jobs that are unlike this. Between 25 and 2014, 955 workers were fatally injured. Guess how many percentage were men? Almost 90%. Unfortunately, the lifestyle choices of men, many of us, well, we smoke, we have poor diets, unsafe alcohol consumption, we drink too much booze, and we have too many other substances. Frequently we have them, and they have negative consequences on our health and well-being. An effective men's health policy is still needed. Yes, there are some one-off programs, and we've seen those things, mates and trades and things like that, but no one overarching policy has been here, ever. While some successful initiatives and programs that target men are currently established in New Zealand, we've seen a few of those, a cohesive, overarching approach to men's health is lacking. Focusing on men's health doesn't have to come at the cost of women's health, but too often, and we see this every year, men's health is forgotten, and we are our own worst enemies at times as well, and we don't help ourselves.
Editor-in-Chief with Duncan Garner.